Please salute. Follow me. First. Abdul, festival. श्रीमान डॉक्टर निरीक्षण के लिए हाजिर है.
Okay, sir.
Yes, perfect.
Students of all the allied health sciences, your accomplishments reflect your passion and commitment to advancing the frontiers of healthcare. As a devoted follower of Buddhist teachings, let us begin our reflections by drawing inspiration from the teachings of Buddha, a timeless guide that illuminates the noble eightfold path, encompassing right view, right intention, right speech, right action, right livelihood, right effort, right mindfulness, and right concentration. I wish to invoke in each one of you this spirit of righteousness as you embark on the challenging but wonderful journey ahead in your lives. Also, do not waver from being patient-centric nobility that defines our noble profession in whatever your endeavor to accomplish. Today, we are privileged to confer Doctorate of Science from Dr.YSR University of Health Sciences to Dr. Pratima Murthy, our distinguished chief guest, in recognition to her contribution not only in the field of medicine in the form of teaching, research, administration, but also her remarkable service to the society and community outreach. She has received numerous awards and honors, including prestigious Dr. Raja Ramanna State Award by the Government of Karnataka, Life Achievement Award from the Rotary, and the WHO Regional Director's Special Recognition Award on World No Tobacco Day. Madam, we are honored by your presence. Convocation is unique, a day of joy and aspiration in the career of students as their dreams are fulfilled and prepares them for future challenges. For the university, it is more precious as it distributes certificates of authenticity to the future physicians and scientists to render altruistic service to the society. I congratulate all the proud recipients of gold medals, silver medals, certificates of merit, and recipients of degrees of various specialties, super specialties, and PhDs. The role of artificial intelligence looms prominently in the evolving landscape of health care. To walk the path and its giants in the industry, you must be proactive in learning, adapting, and excelling. However, in this technological journey, we look towards the future. Let us embrace a spirit of collaboration and championing multidisciplinary, interdisciplinary, and integrated approaches in healthcare. On this solemn occasion, may I seek the permission of the Honorable Governor and Chancellor to present a brief report of progress and activities of the university. Thank you, sir. In the academic realm, our university has achieved significant milestones, including the establishment of new colleges and increased admissions. Notably, we have introduced 5 new government medical colleges, 23 nursing colleges, 34 physiotherapy colleges, 19 medical lab technology colleges, and 6 new paramedical colleges, for which we are all thankful to our Honorable CM. Moreover, we have witnessed a substantial increase in PG seats, enhancing opportunities for higher education in healthcare. Our commitment to research and development is evident through initiatives like Undergraduate Student Research Scholarships, UGSRS, supporting 748 candidates, and faculty research grants benefiting 48 faculty members. We continue to foster a culture of PhD research, conducting workshops, inviting new guides, and admitting promising candidates. In the realm of publications and digital access, our university manages the Journal of Dr.YSR University of Health Sciences, collaborates with Walter Clover's Publishers Private Limited, and coordinates the YSR MedNet Consortium and Digital Library, providing access to thousands of e-journals and e-books through MyLoft portal. The administration has made strides in recruitment and outsourcing transmissions. Noteworthy achievements include introduction of online certificates issuance, online payment gateway, and QR codes for seamless financial transactions. In the examinations, we have incorporated peripheral scanning, and the university is issuing all certificates through online. In the works wing, the installation of a bronze statue of Dr. Y.S. Rajashekar Reddy and supply of high availability servers showcase our commitment to the university's infrastructure. Our sports team have excelled, winning medals in roller skating, taekwondo, and participating in various inter-university tournaments in all India level. University conducts the games and sports for all the affiliated medical colleges and paramedical colleges regularly. The National Service Scheme has received several accolades and awards at the national and state level. Admissions, examinations, and financial operations have been improvements with the introduction of online services and efficient financial management. To conclude, our university is advancing on multiple fronts, combining academic excellence, research innovation, and a concomitant commitment to holistic student development. As we move forward, let us continue to work collaboratively towards creating a healthcare landscape that embodies both progress and compassion. Honorable Vice Chancellor Sir and esteemed guests, as we celebrate the achievements of our graduates, let us collectively envision a future where the wisdom of the past converges with the innovations of the present, creating a healthcare landscape that is not only advanced but also deeply compassionate. Congratulations, graduates. May your endeavors be marked by success, and may you carry the teachings of today into boundless possibilities of tomorrow. Thank you very much.
Good morning all. It is an honor and privilege to present Dr. Pratima Enhance, Bangalore. In recognition of her exemplary dedication to the advancement of health sciences, proudly confers the degree of Doctor of Science upon Dr. Born on 13th March 1961, had a very good. Madam later started her professional career as SR in Enhance, Bangalore in the year 1989, and she worked as a registrar in Manchester and Lancaster Moor Hospital for a couple of years. After that, she came back to her own alma mater and joined as assistant professor in the addiction and Department of Psychiatry in 1993, and she continues to serve the same alma mater till today in various capacities as assistant professor, associate professor, additional professor, senior professor of psychiatry, and she assumed the charge of office of the director on 18th June 2021 and is continuing her services as the director of the Enhance till today. She also, apart from this career in Enhance, she also had various other responsibilities in Enhance Bengaluru, including head of the Center of Addiction Center in Enhance, head of the Department of Psychiatry, the same institutes. She was pivotal in setting up a heritage museum in Enhance, and she is instrumental in making the Enhance the Institute of National Importance, which has celebrated 160 years of mental health care in Bengaluru. Madam is a distinguished psychiatrist with a vision. She has made unparalleled contribution to the understanding and treatment of the various mental health disorders. Her unwavering commitment to the research, education, and clinical practice has not only transformed Enhance into the global center of excellence, but also she has made a significant impact in the lives of countless of individuals struggling from the mental health disorders. Madam is a trailblazer in her field with numerous accomplishments, particularly in the field of addiction prevention and treatment in clinical setup, community setup, and workplace settings. Her innovative approaches in the treatment and rehabilitation have set new standards in the provision of care, emphasizing a holistic and patient-centric approach. She has also been a popular teacher, researcher in this area, and she has been a consultant to the various international agencies like WHO and United Office on Drugs and Crime. She is instrumental in developing a national policy in substance use and mental health, including the formation of the popular Telemanas initiative. Her work with the National Human Rights Commission has led extraordinary changes to the mental health care and recognition of the rights of the person in mental illness in India. Madam, with her astute understanding of the complex interplay between the neurological and psychological factors influencing the mental health, is committed to integrating approach to physical and mental health. Dr. Pratima Murthy Madam is a Life Fellow of Indian Psychiatric Society, South Zone, Karnataka, Life Fellow of the International Medical Science Academy, Fellow of Royal College of Physicians and Surgeons, Glasgow, UK, and International Associate, Royal College of Psychiatrists, UK. Madam is also a recipient of various awards like Senior Psychiatric Awards, Senior Psychiatry Award from various awards from the Pune Psychiatric Association, and Raja Ramanna Award for Excellence in Science from the Government of Karnataka and Karnataka State Council for Science and Technology, Rotary Award for Lifeline Achievement in the Substance Use, and WHO Regional Director Award for the Tobacco Control, and various other awards. With more than 250 peer-reviewed journal publications, 26 book chapters, Dr. Pratima Murthy has also written various books, monographs, and special issues in various journals. Mr. Chancellor, sir, in recognition of her outstanding contribution to the advancement of the mental health care, her leadership in shaping psychiatric care, and her tireless efforts to reduce the stigma surrounding the mental health disease issues, Dr. YSR University of Health Sciences is honored to bestow upon Dr. Pratima Murthy the degree of Doctor of Science on the 6th day of February 2024. May I, Mr. Chancellor, now present Dr. Pratima Murthy and pray that she will be conferred the degree of Doctor of Science of Dr. YSR University of Health Sciences. Thank you.
By virtue of the authority vested in me as Chancellor of Dr. YSR University of Health Sciences, Andhra Pradesh, I admit you to the degree of Doctor of Science honoris causa of this university on account of your eminence and attainments.
Thank you, sir. Let the candidates of all the degrees and diplomas to which you have been recommended, you will
Dr. Mayank Agarwal has won Professor MRC Naidu Gold Medal for Best Outgoing Student in MCH Neurosurgery. Dr. K. Sai Harisha won Sri Mahesh Narayan Memorial Gold Medal for Best Outgoing Student in DM Nephrology. Dr. Sudhanva V. Kinnan won Parupudi Gopala Krishna Gold Medal for being the best outgoing student in DM Gastroenterology. Dr. K. Aparna Swati won Dr. K. Venkateswarlu Gold Medal for Best Outgoing Student in DM Neurology. Dr. V. Shravan Kumar has won Dr. TBG Tilak Memorial Gold Medal, Dr. TV Krishna Rao Gold Medal, 6th AOC Prize Endowment of AOI, Dr. A.F. Desmond's Prize for being the best student in MS ENT exams in first attempt statewide, for scoring highest marks in clinical examinations, passing MS ENT. Dr. Takalapalli Jahid Hussain Professor Etirajulu Gold Medal, late Dr. P. Lakshmi Varaprasad Memorial Silver Medal for being the best student in MS Orthopedics. Dr. Maridi Aparna has won Dr. Ratnakaram Srinivasacharya Gold Medal, Dr. Swami Saran Bommakanti Memorial Gold Medal, Dr. Kosaraju Rajeswar Rao Silver Medal and Prize, Dr. C. Mangaya Sharma Memorial Prize for being the best student outgoing in MS Ophthalmology. Dr. Rambabu Boduluri has won Dr. Dharmavaram Amrutavalli Memorial Charitable Trust Gold Medal, late Dr. Krishna Rao Purohit Gold Medal, S.V. Rao and M.M. Swami Gold Medal for securing highest marks in MD Pediatrics. Dr. P. Jyoti Krishna Kumari has won Dr. P. Arjun Rao and Dr. P. Nagabhushanam Gold Medal for securing highest marks in MDS Orthodontics. Dr. K. Sharmila has won Dr. Sharada Devi Bhavani Memorial Gold Medal, Dr. Sri Sarveswar Rao Shyamalamba Memorial Gold Medal for securing highest marks in subject of gynecology and Ayurveda. It's called Prasuti Tantra. Dr. Dandu Umavalli has won Ganga Govind Nilangekar Gold Medal, Dr. Cherukupalli Dinakar Memorial Gold Medal for best outgoing student who passed in MD Ayurveda in Kaya Chikitsa. Dr. R. Srikanti has won Dr. Mudunuru Kutumbarao Silver Medal for being best outgoing student in Materia Medica in MD Homeo. Dr. Karumudi Pratyusha has won Sri Ramachandra Hanumantarao and Sri Rajalakshmi Prize, Dr. T. Srinivasan Memorial Gold Medal, Dr. K. N. Rao Gold Medal, Dr. Pulapatti Srinivas Memorial Gold Medal, Kavuri Haimavati and Kavuri Chalapatrao Prize, T. Sarojamurthy Gold Medal for best outgoing student in medicine in MBBS. Dr. Sadhu Pujita won Dr. Srinivasan Memorial Gold Medal, Dr. Pulapatti Srinivas Memorial Gold Medal, T. Sarojamurthy Gold Medal, Dr. Badiya Purushottam Rao Gold Medal for best outgoing student who secured highest marks in subject of general medicine in MBBS. Sadhu Pujita Memorial Gold Medal, Dr. K. Chiranjeevi Gold Medal for best outgoing student in final BDS. Akshay Tandle has won Vaidya Vedi Dr. Pilla Ellayya Memorial Gold Medal, Dr. Peruri Sharma and Lakshmi Kantam Memorial Gold Medal, Dr. Achyuta Lakshmipati Rao Silver Medal for best outgoing student in BA MS. Patel Sai Sindhuja has won Nyayapati Venkata Srinivas Rao Gold Medal, Professor Nannegari Ramayya Gold Medal, Dr. Surapaneni Chandramouli Endowment Prize for Best Outgoing Student in BHMS. Dr. Sadiya Begum has won HK Sarjat Gold Medal for securing first in BUMS exams in all stages in single attempt. Please come. Sadiya Begum. Marchavolu Venkata Sai Sujita Sreya, Dr. HK Bakru Gold Medal for securing highest marks in final BNYS, Naturopathy and Yoga Sciences, Part 1 by Part 2 exams in single attempt. Dr. Gantala Pal Kiran, Sri Anumolu Seshagiri Rao Memorial Gold Medal for being the best outgoing student in DM Cardiology.
Dr. M. Anuradha, DM Cardiology. Candidates to be admitted to the PG degree of Doctor of Medicine in Ayurveda. Mr. Chancellor, I present to you in accordance with the grace of Executive Council just passed the candidates whose name is herewith submitted for admission to the degree of Doctor of Medicine in Ayurveda, that is MD Ayurveda in the Faculty of Ayurveda.
Permitted.
Mr. Chancellor, I request
Honorable Governor of Andhra Pradesh and Chancellor of the Dr.YSR University of Health Sciences, Shri Abdul Nazeer, Vice Chancellor Dr. Babji, members of the Executive Council, Registrar Dr. Radhika Reddy, the Deans, heads of the departments, members of various faculties, invited guests, our young graduates who are the heroes of today's function, staff, ladies and gentlemen. At the outset, let me say I deem it a huge honor and privilege to be bestowed the Doctor of Science honoris causa of the YSR University of Health Sciences. Thank you very much for considering me worthy of this honor. And I thank the Honorable Chancellor, the Vice Chancellor, and the Executive Council for including me amongst the galaxy of achievers you have earlier considered for this award. I understand this is the first time a woman has been conferred this honor and a psychiatrist has been conferred this honor. So this is indeed a special privilege. And if I'm standing here before you, it is because of the numerous individuals, right from perhaps when I joined nursery to my professional career, who have shaped me in my area of specialization. In the words of Isaac Newton, if I have seen further, it is by standing on the shoulders of giants. Every profession is sculpted and refined by many people along our way, and we learn and imbibe some of the other lessons we learn from life from them. The motto of this university is Vaidyo Narayano Hari, indicating the exalted position in which healthcare professionals, particularly doctors and others, were traditionally placed. To be able to be anywhere close to this, to emulate the giants who showed us the way, it is important to reflect on what makes a good professional. Being a doctor, or indeed any other healthcare professional who graduated today, it is important to contemplate on our caring profession and ask ourselves what makes a good healthcare professional. Edward Livingston Trudeau, the founder of a famous tuberculosis sanatorium in the United States, sums it up beautifully. To cure sometimes, to relieve often, and to comfort always. That really is our philosophy and our approach to care. Caring attitudes and empathy must always accompany the knowledge that we acquire during our training, and after that we must facilitate recovery in patients, particularly in those who have chronic recurring ailments. This means that our care must always be patient-centered, but at the same time we must apply the updated knowledge in the care of our patients. While patients do pay for their care in many situations through the medium of money, any patient's true assessment of your true worth is measured by the lives that you have touched, the changes that you have made. Of course, updating your knowledge also means being a lifelong learner. So remember, you've just entered the journey now and there's a huge journey ahead of you, and oftentimes this is not easy. In 2020, almost 1 million papers were cited on Medline. That is over 100 new medical papers every hour. Even if you're a speed reader and read almost continuously, you can't even hope to read 10% of the papers in your own chosen area. But just imagine if you didn't read, how much behind you would be in your area of knowledge. Of course, don't be overwhelmed by this influx of knowledge. It's important to know how you can keep abreast of such knowledge through reading review articles maybe, through attending updates, as well as engaging in discussion with your superiors as well as your peers. COVID has made webinars the most popular learning platform, and they continue to be a major medium of continuing professional education. As a psychiatrist, I cannot emphasize enough the importance of mental health. Mental health has traditionally received a much lower priority than many of the other very fascinating disciplines in medicine. And this is somewhat misplaced because 1 in 10 individuals in the country has a diagnosable mental disorder, and for each person with a diagnosable mental disorders, there are several hundred people with sub-threshold psychological distress. This means that there are 150 million Indians with a diagnosed mental disorder like depression, anxiety, substance use disorders, as well as severe mental disorders like schizophrenia, bipolar mood disorder, which are associated with premature mortality as well as significant disability. With increased longevity, we all know that dementia is another challenging condition that we need to address. Another growing concern, of course, is the loss of valuable human capital, especially young human capital, to suicide. Data suggests that 12 out of every 100,000 deaths occurs due to suicide, and that has grown disproportionately larger amongst women, young people, as well as the elderly. Suicides in persons pursuing higher education and among medical trainees is also a matter of huge concern to our profession. We all know that mental health is shaped by biological, sociological, as well as psychological determinants. Mental health is also very closely intertwined with our physical health, something we don't realize often enough. Persons with mental illness are at higher risk to die from non-communicable diseases like diabetes and cardiac disease. Similarly, persons with non-communicable diseases are far more likely to suffer from depression and anxiety. And this can impede treatment adherence, response, as well as outcome, even from the physical disorder. And both mental illnesses as well as other non-communicable diseases have common preventable risk factors like the use of tobacco, alcohol, lack of physical activity, inadequate diet or improper diet, and the inability to cope with stress. Sadly, our approaches to medical disorders always occur in silos. More recently, especially after COVID-19, we've begun to recognize and realize that mental health conditions must be recognized and appropriately treated alongside physical illness. This to some extent also reduces the stigma associated with help seeking for mental health condition. I constantly urge that all medical professionals please routinely assess for mental health symptoms in your patients presenting with physical illnesses, as also acquire the basic skills to handle such situations. Good communication skills are anyway very important for all physicians, and therefore learning some psychological support skills, appropriate referral can improve overall health outcomes among patients. At NIMHANS, we're also looking to decentralize neurological disorders as well as neurotrauma through developing a hub and spoke model as well as the Karnataka Brain Health Initiative in conjunction with the state government. There have been many consistent efforts to improve mental health care in our country through the expansion of the district mental health program in almost all the districts in our country. There is also legal and policy formulations like the newer Rights-Based Mental Health Care Act, a mental health policy, and of course the recent Telemanas initiative, which in just 1.5 years has already got more than 6 lakh calls and is providing telephonic counseling as well as referral to people with common problems like sleep problems, low mood, anxiety, as well as interpersonal problems, violence, suicidality and substance use. Mental well-being and counseling will also be provided in the Ayushman Health and Wellness Centers or the Arogya Mandirs, which are being set up across the country. I am sure the YSR University of Health Sciences, which enjoys pride of position as the first health sciences university in the country and offers courses not just in modern medicine but in so many traditional medicine subjects, is well poised to integrate basic mental health counseling and training in all its courses, both undergraduate as well as postgraduate. This will certainly enable you to become a model university in the entire country. Lastly, a final word for today's young graduates. You have an exciting road ahead of you. It's exciting, but it's hard. Post-graduation, of course, for the ones who have just finished their degrees, further specialization and practice for everybody, and making your mark in an increasingly competitive world. But the very challenges that you face will bring out the best in you if you're properly prepared. In some ways, I envy you. You're getting into a profession where absolutely exciting things, exciting discoveries, particularly technological discoveries, are occurring in every domain of medicine. Something that is both an opportunity as well as a threat. But as long as you aspire and imbibe the qualities of a good physician, technology will never be a threat to you. It will only be part of your armamentarium, but will never replace you now or in the future. The American Medical Association defines newer competencies, much different from the older competencies and the traditional competencies that we had for the physician of the 21st century. These include, some of them of course are traditional values as well. These include inquiry and improvement, interdependency with other health professionals, which is something the physician of the 21st century must learn about. Information management, because there is such a surge of information in a cognitively overwhelming world, interest and insight, as well as involvement in patient interactions. One danger of technology is a reduction in patient interactions, and remember, therapeutic alliance is very, very, very critical for patient outcomes. While the challenges of the 20th century was to add years to life, we now know that it's more important to add life to years, especially with increasing expectancy. In doing so, please look after your own physical as well as mental health. Remember, physical and mental health are as important for healthcare providers as it is to your patients. They are important determinants of your own lives, including your professional activity, which has a direct impact on the health and lives of your patients. So please take care of yourselves and reach out when in distress. Help to create environments which are caring, supportive and nurturing for yourselves as well as for the persons you cared for. Develop some interest outside of medicine to which you can turn to both for relaxation as well as for relief. Nurture your social connections with your families as well as with your friends, and do not feel isolated at any point. Practice Ubuntu, which principally indicates humaneness and a sense of collectivism. I am because we are. From the Bhagavad Gita, one could elucidate the final attributes of a good physician, one who has excellent knowledge, equanimity in all situations, and emotional equipoise and behavior, has a pro-work attitude, is patient-centered in providing care, and has perceptive leadership. A final word of thanks to all the parents of these young graduates who have sacrificed a lot for bringing them where they are today, the teachers and staff of all the medical colleges which are affiliated in this university. Congratulations to all of you. And once again, congratulations to all the new graduates, both present here and perhaps those who have graduated and are not here today, your families, your teachers, your near and dear ones, and your university for your success in reaching here, and all good wishes to all of you. Thank you very much.
Chief guest of today's convocation, Dr. Pratima Murthy, Director and Senior Professor of Psychiatry, NIMHANS, Bangalore, Dr. Korukonda Babji, Vice Chancellor, Dr. YSR University of Health Sciences, members of the Executive Council, members of the faculty, registrar, administrative staff, donors and guests, my dear students and recipients of degrees and medals in today's convocation, and their proud parents, members of the media, ladies and gentlemen, my warm greetings to you all. It gives me immense pleasure to be here amongst you all at the 26th annual convocation of Dr. YSR University of Health Sciences as Chancellor of this esteemed university. On this auspicious occasion, I would like to congratulate all the students receiving their degrees in various undergraduate and postgraduate courses, the medal winners, and those who are felicitated for excellence in their respective fields of expertise. I also congratulate Dr. Pratima Murthy, esteemed Director of the National Institute of Mental Health and Neurosciences, Bangalore, who is being conferred the honorary doctorate of Dr. YSR University of Health Sciences here today. Andhra Pradesh has always been in the forefront of healthcare services and medical education, and we can proudly say that the University of Health Sciences, which was established in 1986, was the first of its kind in the country. On the medical education front, our state has been making rapid progress compared to the rest of the country and South India. Today, Dr. YSR University of Health Sciences has under its jurisdiction 439 colleges offering medical, dental, Ayurveda, homeopathy, Unani, naturopathy and yoga, nursing, physiotherapy and other allied health sciences and paramedical courses, providing training to thousands of students in various branches of medicine and allied fields. Healthcare profession is the noblest of all professions. Please understand this. Healthcare profession is the noblest of all professions, and you are all indeed fortunate to be chosen few in this profession. It was proved time and again more particularly during COVID-19 pandemic. To achieve success while delivering healthcare, both curative, promotive and preventive, you must work hard with sincerity and commitment. Vaidya Devo Bhava, equivalent to God. As you all aware, in a profession that deals with well-being of humans, people have expectation of services of highest order from you, untainted by any tinge of corruption or incompetence. You have entered a field in which you cannot remain contented with your achievements, but must constantly improve your skills by study and research, as the field of medical sciences is rapidly evolving and progressing. You must continue to remain and ethical, unmindful of the societal forces that may induce you to act otherwise. Dear students, unlike other professions, people expect and demand practitioners of medical profession to provide best and unconditional services. You have a fiduciary duty and responsibility towards the society, and you may sometimes have to bear a lot of pain and suffering, and sometimes you may have to sacrifice your personal interests so that your patient may live for another day, or that a family may enjoy their dear ones coming back home hale and healthy. But in the end, the gratitude and affection that you may win from your patients and their family members will give you a soothing experience and relieve you from the stress and give you the greatest feeling of joy and satisfaction, which, please understand, no other profession or duty can offer. Right? During COVID-19 pandemic, doctors played a crucial role in diagnosis, containment and treatment. Their dedication and commitment to treat affected people despite increased personal risk is highly appreciable, and it is the best example of public health response. The society as a whole will forever remain grateful to all the healthcare professionals and the frontline workers for their remarkable services provided during the pandemic. Recognizing the need to provide quality healthcare to the citizens of the state, successive governments have been striving hard to ensure availability of qualified healthcare personnel and essential medicines in all government hospitals. It is in this context that the compulsory one-year senior residency has been introduced. I think now you are disappointed. I sincerely urge all the budding doctors to readily go forward to serve the underprivileged and give them the succor, while at the same time hone your skills under the guidance and expertise of senior doctors. Dear students, wherever you go, remember that the patients and your institutions come first, and then your family and yourself. You have come by choice and not by chance, I suppose, right? Have you come by choice or chance? Choice. In healthcare sector, significant progress has been made both at the national and state level. The center's flagship healthcare program, Ayushman Bharat, covers over 10 crore people and vulnerable families, providing coverage up to 5 lakh per family per year for secondary and tertiary care hospitalization. At the state level, about 10,132 village healthcare clinics have been operationalized across the state, and a unique family doctor concept is personalized. Home-based treatment has been launched. In addition, we have about 1,142 primary health centers, 177 community health centers, 53 area hospitals, 12 district hospitals, 11 teaching hospitals, 15 specialty hospitals, and 542 urban PHCs. The medical procedures covered under our YSR Arogya Shri scheme has gone up to 3,257, offering free medical services up to rupees 25 lakhs. 70 new medical colleges are under construction, out of which 5 medical colleges have already become functional, in addition to modernizing 11 existing medical colleges. Action has also been taken to fill 53,126 vacancies in various categories in medical and health department over the period. Healthcare education today is a difficult and challenging field to enter, and once you enter the college and the profession, you must commit yourself to a lifelong journey of hard work, commitment, sincerity, and education to keep up with rapid advances in healthcare and to provide health and therapeutic services to all the needy persons. It is not a 2020 game, cricket match, cricketing language, nor even a one-day international. It is only one innings. The entire life is one innings. No shortcut. Straight line is the shortest route for success, right? Straight line. One of the earliest schools of medicine known to mankind is Ayurveda. It was consolidated by Charaka nearly 2,500 years ago. Sushruta, father of surgery, used to conduct complicated surgical procedures 2,600 years ago without the sophisticated instruments of today. When the science of anatomy was confused with different theories in Europe, Acharya Charak revealed the facts on human anatomy, blood circulation, embryology, pharmacology, and diseases like diabetes, heart disease, tuberculosis, etc. In his book, Charaka Samhita, he has described the medicinal qualities and functions of about 1 lakh herbal plants. He has emphasized the influence of our diet and physical activities over our mind, which is practiced by our generation even today. He has proved the correlation between the spirituality and physical health that contributed greatly to diagnostic and curative sciences. He has also prescribed the ethical charter for medical practitioners 2 centuries prior to the oath. The advent of technology in medicine has led to remarkable strides in patient care, with robotic surgery and telemedicine being 2 of the most significant advancements. These technologies have shown remarkable synergy in improving healthcare delivery. The integration of robotic surgery and telemedicine is reshaping the medical landscape, offering new possibilities for patient care. As our country embarks on the ambitious plan to become a developed country by 2047, by the time we'll celebrate 100 years of independence, health research becomes crucial to address the country's healthcare challenges. By venturing into health research and technological advances in healthcare sector, it is possible to transform the healthcare landscape in the country and build a healthier future for our citizens and the society. 140 crores of population right now. We are number one, right, in the world. I congratulate all the students who are graduating here today and the winners of the medals. I would like to remind you again that yours is a profession of continuous learning, and you cannot just rest on your laurels or medals, and must strive hard always to remain at the top by enriching your knowledge and skills to serve the people. As somebody said rightly, stay curious and never stop learning. Medical field is constantly evolving, and your thirst for knowledge will set you apart as a future doctor. The health of the people is in your hands. Only healthy people can make the state and the country healthy, prosperous, and productive. Every patient and their family who visit a hospital is worried and concerned about the outcome of the diagnosis and its prognosis, whether it can be cured, the costs involved, and the financial burden it will impose on the entire family. Please understand this. A word of kindness and a smile from you, right? A word of kindness and a smile from you will rejuvenate and boost the patient's morale and value to the effect of medication. Don't be rude, don't be crude, right? Compassion and empathy towards the sick and their families. Your patience and soothing words will have a tremendous impact of comfort for the disheartened patients who come to you in distress. Please remember the words of famous Swiss psychiatrist and psychoanalyst Carl Jung, who said, and I quote, please listen to me carefully, what he said. Medicines cure diseases. Medicines cure diseases. But only doctors can cure patients. Before concluding, I would like to bring to your attention the famous shloka from our ancient scriptures. Sharire jarjari bhute vyadigraste kalebare aushadam jahanavi tayam vaidyo narayano harihi. Means medicine, aushadhi, should be considered as sacred as water from river Ganges. Jahanavi is river Ganges. And that a doctor, that is Vaidya, should be considered as a form of Lord Narayana. Finally, I once again extend my hearty congratulations and best wishes to all the graduates and postgraduate students receiving their degrees in today's convocation. Thank you all. Jai Hind.
Thank you very much, sir.
Thanks on this auspicious occasion of our annual convocation.
Vijay.